Welcome back to the show. We are diving today into the science of soul and movement with Jill Economakos. I hope I pronounced it right. Jill is the founder of Manna Pilates, plus she's a health and multidisciplinary wellness practitioner. Also, her experience spans from Stott Pilates and functional medicine to fascia release and sound healing. Welcome to the invisible reality.
Thank you. Thank you so much for having me, and I'm looking forward to our chat.
Your background as a professional dancer for decades. So,
Mhm.
can you tell us a little bit about how professional dancers shape your understanding of anatomy compared to your formal Pilates training? Like, how is that different?
Yeah, I actually got started in dance at the age of 4 because I was born so lordotic. I had a huge anterior tilt in my pelvis, so I walked really funny. And my mom was slightly embarrassed by me, so she took me to the doctor. What can I do? And he recommended she did yoga with me every day at home. And she wasn't interested in that, so she signed me up for a ballet class. Jokes on her because by the time I was 7, that's all I wanted to do, and she was driving me there 5
Oh,
times a
that's
week.
nice.
Yeah, but it's amazing because obviously I just studied the body
Mm.
and how to move it efficiently from that age. I taught dance once I was like 14. I started with pre-ballet, but then went on and taught at university and for dance companies. And so I was always studying the body, figuring out how to make it move more efficiently.
Mhm.
And strangely, a lot of dance teachers, I had a lot of old school Russian teachers that they are incredible dancers, but don't really have an anatomy background.
Yes.
And it really wasn't, a lot of forcing your turnout and things like that. You never learned about the external rotators of the hips. You're just forcing everything.
Yeah.
And that's why so many dancers end up injured and why their dance careers end so soon. But towards the end of my career, one of the dance companies I was with, the ballet mistress who would come give us our warm up class was a Stott Pilates instructor.
Oh.
And so she had us come in every once in a while to do Pilates with her. And I was like, oh my gosh, where has this been my
You
whole
fell in
life?
love.
Yeah, I did. It was wild. Be like, oh, there's actually muscles I can use to achieve those things. And now I know what I need to tap
Mhm.
into. So that was really the catalyst. Unfortunately, I found Pilates near the end of my dance career because I probably would have been able to dance a lot longer. But I then brought that piece into the dance studio I was teaching at, and then Pilates ended up just taking over.
Do you still miss dancing?
I do. It was wild because it's so hard because it's all you ever know,
Mm,
right? When you
yeah.
only do that one thing. And I remember I had my big retirement performance and my retirement party at the ripe old age of 27. And I remember for about 2 years when people asked what I did, I couldn't not say dancer. I didn't know how to introduce myself anymore. I didn't know who I was anymore. You hear that a lot with like Olympic athletes too, right? When
Yeah.
they're that's all they had known, that's all they trained for, and that's hard. So it was really hard. And a couple years later, I moved to Colorado and everything just started to shift more and more. But I definitely missed that place to just be able to express myself without words.
So, what would you say the average of a dancer's retirement?
Generally before 30.
Oh
Yeah.
my God, that's
You
too
have a couple
early.
I know. And you have a couple amazing people like Barishnikov, whose bodies were just designed to dance and do it long term, or they'll go into like choreography or teaching, things like that. But yeah, it's a lot of strain on the body. And again, unfortunately, a lot of dance teachers don't take kinesiology or anatomy
Yes.
classes. So I think I kind of cringe when I think about all the forced stretches. They used to have us lie with our backs on the floor and our bottoms against the wall into a side split. And because, again, my hips were so tight, they would have somebody take one leg, they take the other, and just slam them to the ground. And I just cringe.
Oh, you know what? My
Mm.
daughter go to gymnastic and she loves it. I think she's gonna do it more often during the week. But I've seen that in gymnastic, like they force them to do the split.
Yeah.
And I'm like,
Yeah.
oh, that hurts.
It hurts and it's not safe.
Yeah.
It's not safe. There's definitely a much more gentle approach
Mhm.
that will assist in longevity in whatever you want to do.
Was there a specific moment of like injury or like in your career as a dancer that shifted your focus from performance to holistic health?
Yeah. And it was a bit of a journey. I have hyperextended knees. And so, what a lot of people will tell you to do is bend your knees a little bit so you
Mm.
don't lock them. That's not right. I'm going to try to explain something.
Yeah.
If your knee is like this, oh, that's not a good visual. But if you're sitting with your leg on the floor and you go to straighten your leg and you're hyperextended, you do this, right?
Yes.
Your foot will bounce up a
Yeah.
couple inches.
Yeah.
So what people say is, oh no, put that foot down, just bend your knee a little bit. But actually, if you place the foot down and tell your knee to straighten and squeeze, it will. And all of a sudden, you don't just feel a quad, you feel the hamstring. So then the knee joint is
Oh.
supported, right? But I wasn't told that. So I started to, with that little bend in the knee, my lateral quad overdeveloped. I started pulling my kneecap off alignment. So I had terrible patella tendonitis. And then with all the tracking being off, my knees just swelled up the size of honeydew melons.
Oh my
And in the dance
God.
world, it's not like, oh, let's take a break and rehab this. It's, well, you want to be in this performance or don't you? So you just keep pushing. And I remember I had been heading out. I was in my senior year of high school and I was going off to Boston Ballet, but I couldn't walk anymore. I was walking like a 99-year-old man who's never used his body. It was really painful. And I went to every doctor in Chicago and they were just like, nope, you are done. And so just had to have this huge shift. I ended up, okay, now what do I do?
Mhm.
I went to a college that in state that I knew the master of the dance department was a teacher who had actually was a guest teacher at one of our studios in my youth. And so I just went there, even though I wasn't able to dance. And I'd walk by the studio and I'd just kind of look in and my heart would break. And he was amazing. He brought me in. And what he would do is actually hang me from gravity boots every day.
Mhm.
Or with a little hook around my ankles and just dangle and kind of like gravity
Yeah.
pull things back in. And he started training me properly. And so with that, I was able then to go into a dance career for a while after that. But it was just such an aha moment for me, knowing that there was a better way. There was a much better way.
So, what's the difference between this teacher and the other teacher? Did he have any background in anatomy or did he teach himself?
He taught himself through the years. And I think the fact that he worked at the university where we had kinesiology
Mhm.
courses and anatomy courses, I think he also partaken in quite a bit of that. So he just had a much better understanding of that. And then fast forward through the end of my dance career, after being with a couple companies and meeting that woman who started teaching me Pilates, it was just, again, an aha moment of, wow, we all tend to keep pushing our bodies when they're trying to give us a little message,
Mm.
right? There's a little whisper that it's not enjoying what we're doing to it. And oftentimes we just think, if I just keep pushing harder, push through it, but that's what ends up leading to injury. So I've become really good at reevaluating what does my body need and asking it not just when there's injury, but on a daily basis. What does this body really need today? Instead of all that punishment we tend to put ourselves through.
Oh my God, that's beautiful. So, demystifying fascia, the living whip. So, for people who doesn't know that term or never heard of it, can you explain what is fascia and why it's very important for movement and mobility?
Mm. Yeah, yeah. Oh, fascia is just amazing, isn't it?
Yeah.
So fascia is a connective tissue that surrounds every muscle, ligament, organ, bone in our bodies. It doesn't break apart anywhere, which is amazing. So think of it as like a soft skeleton. It should be strong. There's collagen protein in it, but it should also be hydrated and supple. So
Mhm.
it's strong and stretchy and can move with us.
Mhm.
It facilitates blood flow and oxygen. So when our fascia is happy, there's not that restriction and tightness in our body. So what tends to happen is because of poor breathing patterns, poor posture, trauma, injury, surgery, repetitive patterns, not enough movement.
Yeah.
Sounds a lot like the human experience.
Yeah, right
That
now with the modern life. Yeah.
Yeah, that fascia that's actually beautifully organized
Mm.
tends to get disorganized and tight and crumpled. And then our whole body is overcompensating for those tight areas.
You mentioned before because you were treating me for fascia. What do you call it? Fascia
Release.
tightness? Yeah. And
Mhm,
then I saw you in the retreat and you said fascia can store emotional trauma. So, how does
mhm.
the physical manipulation or movement help release those non physical blocks?
Because you think what moves energy, right?
Mm.
It's movement, it's sound, it's breath.
Mhm.
And I think right now, if all of a sudden some monster came into your office and screamed at you, what would you do? Right? This.
Yeah. Oh, I'm hyper vigilant. So, yeah.
Yeah, yeah, and you're not alone, right? Everybody living in the
Mhm.
sympathetic nervous system like it's a normal place to hang
Yeah.
out. So our bodies are tight and or even if we've had physical trauma in some place, that area becomes protective,
Yeah.
right?
Yeah.
And it's again like when our muscles tighten up to protect us, that's great, but it's not supposed to stay there, like our nervous system.
Yeah.
So if we don't release that, it causes more problems. So oftentimes what I find when I'm working with people that have had a lot of trauma and they might mentally think they're okay with it, we might get to a part of the body and I have to reiterate it so much with people that you get to a tight spot in that fashion or what I call a sticky or spicy
Mm.
spot. What people want to do is just start trying to work it out, right?
Yeah.
And what very protective tissue does is some danger and tightens up more and we end up bruising it, right?
Yeah.
So getting into those areas that have been caring for us and saying, okay, breathe, relax, let go. You're okay now. And when those tissues start to soften and let go, and air, oxygen, and blood flows back in there, it can be a huge emotional release for people. I have had people cry, I've had people laugh, I've had people get nauseous, I've had people smell strange
Mm.
things. So it's pretty amazing that when you can get into those areas and really relax with it. That's one of the things I love about the fast release work I do. While I take people and guide them through a program that might
Mhm.
be best suited for them, they can do it anytime from the comfort of their own home. So again, let's say you've had some tight injury in your body or trauma, and you're again really protective. And so you make an appointment for a massage or
Mm.
PT or something, which are also great modalities. But let's say you make that call and you can't get in for 3 weeks. So 3 weeks rolls around, you're running around getting your kids out of the ready for school in the morning, you're fighting through traffic, you spill coffee on yourself, you show up, there's bright lights, this person's energy is also off and they're touching you. And
It's like
it's
you're describing me in the morning.
yeah,
Yeah.
that's a lot,
Mm.
right? So now let's say everybody's cleared out, you find even 5, 10 minutes for yourself and you can play your favorite music. You can be in an area you're comfortable with, maybe a little essential oil, a few deep breaths to calm you down. And then you can go into the work all on your own and be where you're comfortable to be within that day and on that part of your body. So I think it's just very efficient that way and very caring that way.
So before I ask my next question, what got you into fascia release and trauma and all of that?
It was a little curiosity and a
Mm.
little accident. I've been teaching Pilates for 20 years now, and I've, do group class as well, but my majority of my work is one-on-one
Mhm.
with people. Because let's say somebody's had a torn rotator cuff or something, or a new mom holding a baby, and they're coming in, this is
Yeah.
all tight. You can try to keep strengthen the opposing muscles, but if this area is tight and
Yeah.
traumatized, what's going to happen? It's going to pull. It's just constant tug of war. When fascia started coming on the scene, there was a lot of fascia health in movement, in Pilates type of trainings. And I kind of went into that thinking, okay, I can help my clients with that physical part so we can strengthen them faster. And I took the course and it didn't, it gave me just a little tiny slice of what I wanted. And I was like, there has to be more. And so I started learning. I took more courses, I read more books, I did more trainings, I practiced on myself. And not only did I first see, wow, I am seeing such postural changes
Mhm.
in 3 times the speed as I did before in my clients, or all those areas that were like they couldn't touch their toes. Oh, now they have more mobility. Um, I it's also like for myself who had been asthmatic and
Mm.
anxious as a kid, I was like, oh wow, like I can move my breath, I can feel my
Your
diaphragm,
chest and
my ribs move. That was phenomenal. And then I met Chang on retreat a few years ago, and we were talking about, and he hadn't really heard of fascia at that
oh
point.
yeah.
We started to really talking about it. And then he first had me come on his retreat to teach other doctors about it. I'm like, what? You want me to do what? But I was like, wow, none of the doctors knew about
No,
it.
no, none of us.
None. And so then I got back and he started, because I'm in Denver, he's in Texas, he started sending me patients virtually that have been through the ringer with their health. Generally, people end up with the functional medicine route when they've been going through it for decades, not getting any answers, right?
That's true.
So I started working with some of his patients that have had a lot of trauma, and I just started noticing what was happening within them and saying, oh, okay, this is that piece that they were talking about, but I hadn't really experienced it yet. And so that was the first window to it. And as I've worked now with hundreds of people in fascia work and that one on one work, and knowing that if they're ready, and I can
Mhm.
tell they're ready to go open that door, and if they're not. So that's been wild. And that's, I think, the nice thing about the breath work that I'm doing now, which we can get into later. But sometimes people come in. Um, for example, I had a woman come in from California who has terrible fibromyalgia
Mm.
and had been in a bunch of car accidents. And she came in, okay, I'm ready. She's not breathing. And I was like, okay, if I introduce any touch
Mm.
using any of the orbs on her body, it's not going to accept it. So taking her first through some breath work and then seeing that door open and okay, now we're ready. And she was able to handle all that work beautifully.
Wow.
That
So,
answers your
yeah, as physicians, we have no idea about all of this. And the thing is, we don't have the time to learn, to self heal.
yeah.
It's a lot. But thanks to you and Chang, you guys introduced it to many of us. And I would just turn around and see Ali doing with the orbs. And I'm like,
Yeah.
what are you doing? I'm releasing my fat. I'm doing the work that Jill taught us. So, about the orbs, what led you
Mhm.
to create your own tools for fascia and how do they are different from foam rolling?
Okay. It's a good question. Yeah, that's the thing. I experienced myself the foam rollers and I remember first someone said, "Oh yeah, roll your feet with a golf ball," and all these hard plastics and these hard rollers, and too much. They're
Mm.
too much. Again, we talked about trying to get into the tissue and allowing it to melt.
Mhm.
And I knew that it had to have a little bit of give. It had to have a little bit of grip because we don't just plow, we also pin and mobilize. We twist the skin to get the
Oh, yeah.
superficial effect, right? And I like the soft sphere, the inflatable one is great because you can use it on your
Mm.
diaphragm, on
It
organs.
doesn't hurt
Um,
as much.
it doesn't hurt as much. And then when I've worked with people with fibromyalgia, that's generally a place I start with. Let's just do the same stuff. So you've done the more
Mm.
ab or max
Yeah.
to release the pecs
Yeah.
you were talking about. But somebody with fibromyalgia, sometimes we just start with that inflatable ball and get used to that. So the density is important, the sizes are important. Using the small ones is almost using a thumb to get into certain places. The medium one is more like a fist, and the max one's more like an elbow, just different sizes. so that you can go over larger muscles, smaller muscles. You can get in between. You can use these right on the muscle, right on the bone. They have enough softness to
Yes.
them and size difference that you can really get into the areas you need to.
So it's the idea behind everybody is different
Yes.
and everybody needs something different. Yeah, that because foam rolling is wasn't ever for me.
Yeah.
Yeah,
Yeah.
it's yeah. And it's
Yeah.
big. You can't get into small places.
Yeah, although we go into even like the armpit to get to
Oh
the
yeah, I remember
subscapularis, the ball for the
neck.
SEM in the front, and so even like the TMJ
Hmm.
stuff or your feet, or like, there's all these little areas that you can get into, or even the glutes, like you just
Yeah.
using those Manna Orb mediums into all the various layers of the glute. Just it never works with a foam roller.
With repetition, does the pain go away or?
Yeah, it does get better. So I always use the example because I have, again, being asthmatic and it's then
Yeah.
slightly kyphotic, when taking the two mini orbs down the thoracic, when I first started that, that was like, I felt like there was two boulder rocks there.
Mm,
But now I don't even feel them
that's
there when I
good.
lie on it. So how I explain it to people is that imagine if you ever traveled with a necklace, then you get to where you're going and it's all knotted up
Oh,
and
that's
like
yeah. It's all knotted up, and I don't want to take it off because I don't want to go through
right. And
untangled. Yeah.
it's hours of your
Yeah.
time, right?
Yeah.
So the thing about the fascia work, unlike stretching, for
Oh,
example,
that's
you might
a
stretch,
good
right?
example.
You might stretch your hamstring out, but the fascia is going to pull it back. If you roll your hamstring, it's like you take out one of those little knots of that chain, right?
Yeah.
And then you roll again the next time, and it takes out
Yeah.
another. And then you keep going until it all lengthens out and is smooth again. So, and again, little by little, the whole system is connected. If I have someone, oh, my low back is really tight, I'm like, okay, we are going to roll your feet. If I know they
Mhm.
can't get on the ground yet, they're like, no, I said my back. I'm like, yep, we're going to roll your feet because
Yeah.
the fascia from the bottom of the feet clear through the back body to the top of the head, right? Another example I really love to share, I saw a video once on this YouTube or something, and they had a fella in a unitard
Mhm.
and it had all the various fascia lines on
Wow.
it. And they had him standing and they said, okay, let's say you had a shoulder injury. And they started taking the unitard and twisting it. So what starts happening? He's like this, right?
Yeah.
So not only is that shoulder injury that to the shoulder, but look at his posture, right? And then all of a sudden he's going, they're like, okay, now lift your other arm. And he didn't have that same mobility in that arm. So let's say you're post surgery and you're not supposed to do anything over here for 6 weeks. You can still benefit this side by releasing the fascia here or even in your QL over here.
Wow.
So it's really cool because then I've just witnessed so many people be able to recover from surgery so much quicker too. It's pretty wild.
You know what's sad? This is related to recovery and related to health, and we don't know anything about it. And it's not something that is related to medicine. And patients coming for decades having no
Mm-hmm.
solution. So I don't know if we're going to see that in the future, but that would be awesome if people like you have a place in the clinic or everyone know about that.
I think I agree. I also think, again, like this is another option. This is an important
Mhm.
option post surgery before PT, even. I often think about postnatal. I
Oh
think about
yeah.
all the ones that end up, again, with the shoulders round, the background is scoliosis because they're always
Yeah.
holding their kid in one hip. They end up getting scoliosis. All the weaknesses in their hips or that anterior tilt, like it doesn't just go back. I think about that often. I wish there was more of a care package to give
Yes.
people
That
after
would be
this.
awesome. My pain and like all the tightness started 1 year after my kids and no one knew what's going on.
Yeah.
So
Yeah.
you're a health coach. So, from a health coach perspective, as a functional medicine health coach, what are the most common missing links you see in people's wellness routines and that movement can't fix?
That movement cannot
Hmm.
fix. That's a great
I
question.
mean, movement alone, they have to add something else.
Yes.
Yeah.
Yeah. Good question. So for me, it's oh, stress. Let's start with
Oh, yeah.
stress. Everybody is so stressed and there's so much on their plate. They're hanging on by a fingernail. And what'll happen, a couple things, especially my dear perimenopausal and menopausal women, right? What happens is they're stressed, their bodies are inflamed. And what do? They are unhappy because they may have put on a couple hormonal pounds or whatever. So they come in, I just need a hard workout. All I'm eating today is a salad with raw vegetables. I'm like, okay, so your body's stressed. Now you're taking your poor digestive system and just putting a bowl full of raw veggies in there. So it has to work harder and you want to come in and do a harder workout and you're going and running an hour on the treadmill when not only you're inflamed, but if you're perimenopausal, your tissues are breaking down, you're losing collagen, you're doing a repetitive pattern and you're already inflamed. What's going to happen? What's going to happen to your digestion, your physical body, your mental body? It's just that constant punishment. So to me, it's like I'll get my clients in and either before a session, I'm like, okay, first we're going to do some breath work, or I might do a bit of a sound bath because sometimes people, if they're trying to meditate or connect with their breaths, well, I
Yeah.
got to pick the kids up, I got to finish this at work,
Yeah.
I got to do this.
I have laundry.
Yeah, all those things. And the sound bath kind of just naturally takes them there and shifts their energy, which I love. And then I say, okay, it is 30 degrees outside. Let's maybe like a warm soup or something easy for your body to digest. And let's check in. What does your body really need today? Oh, gosh, yeah, you are carrying a lot of tension there. Let's release that so you're able to breathe. Now you're able to show up not just for
Mm,
yourself, your kids, for your coworkers, whatever it is. So that's a really hard one because again, if people keep thinking if I push her
yeah.
and I restrict my eating and I work out harder and I work harder and yes, I can do that for you. Yes, I can do that. Yeah, it's just
But
it's a
I think it's the mindset too, because you see all the social media figures. It
yeah.
just, someone just gave birth 2 weeks ago and she looks gorgeous. I'm like, I want that. But the thing
Yeah.
is, my body is different. In
Yes.
my
Yes.
pregnancy, I have been fit all my life until I gave birth. In my
Yeah.
pregnancy, I used to do whatever I used to do before. And in
Yeah.
my mind, although I'm a physician, in my mind, a lot of people do that. They work out until the day before they gave birth, but my body couldn't take it.
Yeah. Yeah. And it's so important to listen to it. And I think also to reassess
Yeah.
every once in a while. Like I had a few years ago some random things popping up, and I was like, I used to run like 6 miles 3 times a week. Okay. And then I have my Pilates
Oh my
as
God, you're
well.
an asthmatic patient and you run 3 miles. That's
Yeah, yeah,
wow.
6 miles. That's a whole separate story. I cured my asthma when I got pregnant. I just turned 48. My body doesn't like this repetitive motion anymore. I was really tired from it, like weird little whispers from my
Mhm.
body. So now it's okay, twice a week, I run like 3 or 4 miles, but all the other days I walk.
Mm.
So I have to move my body more than I did before so I don't get
Mhm.
tight and sticky, but I have to do it much more gently. And sure, there's like the 48-year-old like Olympic swimmer
You
that can
don't
somehow
look 48
do it.
years old, just to let you know. Yeah,
Thank you.
I'm
But
jealous.
it's
I'm just
well,
kidding.
oh please, you are one of the most gorgeous
Oh,
women I
thank you.
know, and I mean that truly inside and out.
Thank you.
We only see the people that have somebody waking up and making their green juice for them and working them out of their house and driving their kid to school. You don't see the other stuff. And everyone has their own clientele, but same with the Pilates, all the social media Pilates stuff. You see everybody in their little half tops and their
Oh,
six
yeah, yeah,
packs.
yeah.
22 years old,
Mm.
like you can get abs like me. I'm like, get back to me when you have a kid and you're like all these other things, right? And I think if we really stop and ask ourselves, like, do I want to grow old and still look great in a bikini? Or do I want to grow old, be able to hike and crawl around on the ground with my grandkids
Yeah.
and have a strong immune system and all of those things? And I think when we really stop and check in with ourselves, we're going to choose that second option, right? So I think that's important.
You mentioned food. Do you direct or advise clients about food, something that might increase their pain or decrease their pain, or put them in restrictive diet or something? Plan.
Well, my favorite step to start with everybody is an elimination diet because again, like my whole like Pilates, I do it one on one because if you saw 8 of my sessions in a day, they are all drastically different, right? Because the
Mm.
bodies in front of me are drastically different. And it's the same with food. It's the same with our microbiomes are so different, right? So first, I think it's so important to figure out what foods we're sensitive to, which that's the best path to figure it out. And two, give our guts that chance to heal. And then think, okay, now what foods actually fuel us and make us feel good and vibrant, and then build from there.
So I have to nag about that. This is my third day, no carbs and no dairy product. And I feel like
Mhm.
I'm starving because I don't eat eggs without cheese. I can't take the taste. I don't eat meat that much. I don't like the taste. So I'm like, oh my God. The thing is, I'm starving. The nurse practitioner told me, your body, this is the withdrawal from sugar and all the other things. But my pain is less in just
Yeah,
those 3 days.
days. Interesting story is I had a client who she was so swollen and inflamed and I can't get my wedding rings on anymore. And she went to get tested for rheumatoid arthritis. She went to this appointment, getting tested for that. And then I said, okay, are you done? I said, can I take you through this elimination diet? Well, turns out for her, it was corn, which she
Oh,
never guessed. And it was wild. It was same thing. It was like 3 days later, her rings fit her again. Her joints weren't hurting her.
oh.
It's pretty wild. And I always tell people a couple of things. One, it doesn't mean you can never have it again. Know that's one of your sensitive foods. Let your
Mhm.
gut heal completely. And then know that's a food you can just have in moderation.
Okay.
Right. Yeah. So it doesn't mean unless you have physical violent reactions right away, you're throwing up
Oh,
hives.
yeah.
Okay, don't have that food anymore. But if it's one of those things like, oh, my jeans feel tighter the next day, my joints feel tighter, I'm more tired, or my skin's dry, then it's like, okay, once my gut heals, I know that's only a food I can have occasionally.
I'm not swallowing or swallowed or anything, but I do have pain whenever I move. That inflammation pain, that the hot pain, like it's burning, my joints burning. So I don't feel it that much anymore and that intense, which is I'm glad. Today I
Good.
was like, I was dizzy in the morning. I'm hungry, and I'm like, there were some dates that I
Mhm.
love to eat. I'm like, should I take this? Should I just whatever? And then I'm like, no,
That's
I can do this. I can do this.
yes. Yeah. And that's something I always tell my clients too. One, it's not about taking things away, right? It's finding really good substitutions that you enjoy. And at the end of the day, especially those of us that live in the US, all of that stuff will be available when you're done. You can still get a mango in December at midnight if you want
Mm.
in a month. None of it's going anywhere. So
Yeah,
just commit. It's such a gift to yourself. It truly, and I'm always amazed. So you're going to keep feeling terrible. You're going to keep making all these doctor's appointments. You're going to keep trying to take all these different pharmaceuticals.
nothing will help.
Yeah, it's like you have the power with just your food. Yeah.
Yeah, that's true. So can you mention like anonymously a story of a client that's stuck with in your head of an emotional breakthrough when you did fascia release?
I've had so many. I've had so many. It's a hard one to share without sharing too much personal
Mm.
information. And I think it's also when I see that happen with people, I'm grateful for all the tools I have
Yeah,
in my basket,
yeah.
right? To be able to nurture, not just hold space for them in that moment, but help integrate so they can begin that whole healing process after that. A beautiful story, and this isn't so much an emotional release,
Mm.
but a huge emotional reaction due to the fact of how he felt. There was a patient I saw who had been a victim of a hazing crime and was hit with a bat and left unconscious for a long.
Oh,
And he suffered from severe seizures and debilitating daily migraines. And he worked with a functional medicine doctor who helped with the seizures. But we did some virtuals together.
mm.
And we were doing some work, and he started crying. And I said, "How are we feeling? What's going on?" He said, "It's the first time I haven't had a migraine
Oh my
in
God.
years." And I was like, "Oh." And I think people get so used to carrying around pain
Yeah.
and trauma that
Live with
they,
it. Feel like it's part of them.
yeah,
Yeah.
and their identity, right? And that's just how it's got to be for them the rest of their
Yeah.
life. And that's even when I have people come in and they say, "This is for, that's okay. We can do normal work." I said, the work I do is to help get you out of pain. You don't need to stay in pain.
Mm.
Like let's get you out of that. And anytime I can move the needle on the quality of life for somebody a little bit, it's powerful. I feel very grateful for that.
I feel like when someone in pain, they forgot how they feel without it. Like it, because this is how I felt for a long time. I'm like, that's not gonna go away. That's not gonna go away. I don't know how I'm gonna feel without it. You know what I mean? Yeah.
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 Yeah. I always relate it to an armor,
Yes.
like a metal armor. And we put on one piece and head out for the day. And then sometimes we have to put on a little more. And then we're just in this big protective shell, living with the weight of the world on us.
Yes.
Right. And when people can start living beyond their physical body, it's so freeing.
Oh my God, that's nice. Your Jill is an of instructor.
I'm sorry, say that again.
What is an OOV instructor?
Oh, oof.
Oh, okay. So I don't know what is that. Can we
Oh,
talk about it a little bit?
the Oov. Oh
Ooh.
my goodness. It's such a cool piece of equipment a neurosurgeon actually developed. And it took him 8 years to make it just right. I think he's based out of Australia. But it was kind of the same thing. He found that most of his patients post surgery only ever fully improved to 80%. They didn't get their full mobility back. And so he developed this thing. It's hard to explain just in
Yeah.
words, but it's neat because it has a little bit of compression, but then kind of comes back and supports you, similar to the orbs that way.
Mm,
You can lie on it. So if you're lying on the Oov, it decompresses. You're in neutral alignment, but it also slightly decompresses the spine while you're lying on it. Also, your ilia, your scapula fall freely. So they're not lying on the floor.
mm,
They're fully able to move. So what you do, you can do a lot of fascia release work on it differently
mm.
than we do with the orbs.
Is it like a bed or something, or is it foam?
No, it is. Hold on. I'm
Show
going to
me.
take you for a little field trip because I feel like I have one here in the house at my home today. But you can do core work on it. You can stand on it. You can kneel on it. You can side lie on it. You can be prone on it. I do. Okay. Get this out of the way. Okay. We are going to bring this back and do a little show and tell
Okay.
because it actually stands for out of vocabulary because he would be working with all the surfers in Australia,
Hmm.
and he'd have them always lie on their back and try to balance with both feet up and arms reaching up, and they'd all be like, "Ooh, ah, ooh, ah, ah, ooh, ah." So out of vocabulary, but here it is.
Wow.
So it comes in small, medium, and large, all depending on when your spine is. So your pelvis would be here,
Mm,
lumbar spine supported here, your scapula ends up falling here, and then usually this is where your neck would be,
yeah.
and your head is resting on like an inflatable ball that you have the air taken out of. But you can also stand on it with one or two legs.
Mm,
So you can see it wiggles a bit. You can side lie on it, which is really cool. You can flip it over this way and do some extension work over it. It's
Wow.
just a really cool
So,
prop.
do they teach that in like physical therapy
Some do.
schools or?
So it's one of those tools. Some physical therapists will know what it is. Pilates instructor. So the developer started working with one of the Pilates certification programs. So we can incorporate it with work on the reformer as
Mhm.
well now. It's really cool.
Wow. So it's a kind of game changer for spinal health.
Yes,
Okay.
because the spine is supported again, but
Mhm.
decompressed, and you get all the feedback in the world. So if you're even just marching a leg up to tabletop and
Mm.
putting it down, if you're wiggling around, your psoas obviously isn't moving very efficiently, which leads to injury, a lot of tightness in the SI joint. So it gets people again moving really efficiently, and they get the feedback. So if they're not able to mentally connect to their muscles, some people have really great body awareness, some people not so much. Some people in between. And that feedback it gives you really helps.
Wow. Moving from the body to sound bath. How does the vibration of sound bath physically interact with the fascia, and how is that integrated to Pilates?
Okay. So if you think our bodies are made of a lot of water, so
Oh
is
yeah.
our fascia hydrated, right? It all has water. So if you were to look at a water molecule under a microscope and make a sound nearby, hit a chime,
Mm.
you'll see
Then
that molecule
yes.
change, shift. So that's exactly what is happening in our bodies, which is just to me so cool.
Oh yeah.
So cool. And yeah, and again, it's going to, because of the tones and the frequencies, drop you into your parasympathetic.
Hmm.
So that's amazing. And then it takes us into, is that the theta brainwaves right before that dreamy state of right before you fall asleep, right? So you're able to tap into that subconscious where we again might have some
Wow.
trauma or blockage. So it just really moves it without us having to necessarily process it yet a
Hmm.
whole bunch. It just shifts and moves it for us. So the same thing then in a part of the body that might be really dehydrated, right? Or restricted. You get that movement through there. So yeah, it's just such a beautiful tool. And selfishly, I loved it because going from dancing to teaching Pilates all day, I went from loving to be able to not talk and express myself through movement to talking 8 hours a day. And then I was like, oh, now I have this beautiful thing I can do where I can not only express myself, but really tune into what people need and what my intentions are for them and guide it through sound, which I just love.
So I was there in like a couple of your sound baths, and how did you learn? If I, it's because I try to do the thing and it sounds horrible when I do it.
I did go to a training for that with a woman who lives here in Aspen. We did it virtually. It was
Wow.
like a 7 month program. And I just, yeah, I fell in love with it. I had experienced it myself and was just like, again, such an amazing way to get to that part, that
Mm,
brain wave without having to work at it.
exactly.
And then I did the training with her, and she's also a partner for Crystal Tones, and their bowls are just next level. And once you hear them, that's all you want to hear.
Oh.
But yeah, so I did the training and then a lot of practice with it.
You did a lot of things, and you succeeded in integrating Pilates, sound bath, functional medicine, all of those things. I'm glad that we talked to you today, and it has been fascinating listening all. We I think you have many other stories that we need to go through. But for our listeners, you can find Jill at her studio, Manna Pilates Plus Health, located at 3 Ringsby
Ringsby. Mhm.
Ringsby Court in Denver, or online in their website to explore the Manna Orbs, which I personally have two sets of them. And
Yeah, you can get our orbs on the website. There's some complimentary videos there. We also have some on demand
library.
classes.
Yes.
Yeah, we have Pilates, we have the fascia release, we have bar. There'll soon be more sound healing and breath work on there
Wow.
as well.
So if this conversation changed the way you think, about your morning stretch or evening workout, please subscribe and go to her website. We're going to have the website in the description. Thank you so much, Jill. Thank you.
Thank you, Reem.
Have a great day.
You too.